Whenever we take a pill or get a treatment, we just trust that it works, right? But what if that trust wasn't always there? For most of human history, medicine was basically just a giant guessing game, a mix of tradition, old theories, and a whole lot of guesswork.
So how did we get from just guessing to actually knowing? Well, that journey, from simply believing something works to scientifically proving it, is honestly one of the greatest stories in science. It's got everything: rebellious doctors, a ton of careful counting, and these brilliant aha moments that completely flipped our understanding of health on its head.
And this really shows you the massive shift. You see, back then, it was all about authority. If a famous physician said something was true, then that was the rule. Now, it's all about the data. We've swapped one doctor's personal hunch for hard statistical proof from trials with tons of people. It was a total revolution in thinking.
So where did this all start? Well, it wasn't some big, sudden explosion. It started pretty quietly, actually, with just a few brave people who decided to ask a very simple but very dangerous question. Yeah, but how do we know that's true?
And you have to realize asking that question was a huge risk. This wasn't some friendly academic discussion. If you questioned the established medical wisdom of the day, people would accuse you of being reckless, of actually putting patients' lives in danger just for daring to challenge what everyone knew to be true.
A fantastic early example of this comes from a guy named James Lind and his work on scurvy. This horrible disease was just devastating sailors on long sea voyages. But instead of just guessing, Lind did something revolutionary. He designed a simple, really elegant experiment. He took 12 sick sailors and methodically tested different possible cures on them. This was one of the very first seeds of evidence-based medicine.
And the result? It was crystal clear. The sailors who got other things like cider or seawater, nothing happened. But the two guys who were given oranges and lemons, they got better and fast. It was this perfect, straight line from a treatment to a cure. For one of the very first times, a medical treatment was proven to work, not because an expert said so, but because it won a fair test.
But, not every problem was as neat and tidy as scurvy. Just look at the debate over smallpox inoculation back in the 18th century. People were trying to use numbers, but it was a total mess. Nobody could even agree on the basic death rates. And then you had all these other complications, like what about the people who got inoculated but then spread the disease? Or the fact that the numbers were different in cities versus the countryside. It became really clear that just counting things wasn't going to be enough.
And this leads us to a classic pitfall in this kind of work. So there was this physician, Pierre Louis, studying bloodletting. He noticed that the patients he bled early in their illness recovered faster. So great, bloodletting works, case closed, right? Well, not so fast. He missed one crucial detail. His bled early group was, on average, over 8 years younger than the other group. Of course they recovered faster. They were younger and healthier to begin with. That hidden factor, what we now call a confounding variable, completely destroyed his conclusion.
Now this brings us to a true hero of this story, a physician named John Snow. We're in London in the mid-1800s, and cholera is an absolute nightmare, just tearing through the city. Everyone was convinced it was caused by miasma, or bad air. But Snow had a different theory, and he was going to prove it with data.
Snow started his detective work by looking at the big picture. He painstakingly mapped every single cholera death and compared it to the water supply in different London districts. And what he found was staggering. The areas getting polluted water had a death rate more than 10 times higher than the others. The pattern was just impossible to ignore.
But he didn't stop there. He zoomed in even further, and he found this amazing natural experiment happening right there in the city. There were neighborhoods where two different water companies supplied water to houses literally side by side on the same streets. One gave them clean water, the other polluted water from the Thames. When he compared the death rates just between those customers, the evidence was absolutely damning. It wasn't the air, it wasn't the neighborhood, it was the specific water coming out of the tap.
And then, things hit a crisis point. A catastrophic outbreak just exploded around Broad Street. We're talking 500 people dead in just 10 days. It was terrifying. And Snow, through his careful investigation, traced the outbreak not just to a water company, but to one single contaminated public water.
So he's got his data, he's got his theory, and now he has to go convince a bunch of skeptical local officials who are still totally convinced it's all about bad air. And he proposed one simple direct action. That was it. No complicated new medicine, no citywide lockdown. Just a simple, mechanical fix based on his evidence. Stop people from being able to use that specific pump. And just like that, the number of deaths plummeted. By removing the source of the contaminated water, he stopped the outbreak cold. It was this incredible, real-world proof that his data-driven detective work was right all along.
Snow's work was a masterpiece of observational data. But to really test a new treatment, a new drug, medicine, needed to take another huge leap forward. And so, by the 20th century, the stage was set for the most powerful tool we have, the randomized controlled trial.
This became the new gold standard, and the key word here is randomized. By randomly assigning patients to get either a new drug or the standard treatment, you get rid of the exact kind of bias we saw in that bloodletting study. A researcher named Austin Bradford Hill really championed this idea for the first major trial of a new drug called streptomycin, which was used for tuberculosis.
And the initial results? They looked like an absolute miracle. After 6 months, the death rate in the group getting the new drug was less than a third of the rate in the other group. I mean, it was a massive difference. It really looked like they had found a spectacular cure.
But was it? This is where the story gets a little more complicated, and where you see the true power of long-term rigorous testing. Because those amazing 6-month results, yeah, that was not the end of the story.
Take a look at what happened after 3 years. That huge survival advantage had almost completely vanished. So what was going on? Well, the trial had revealed something critical that they would have missed otherwise. The tuberculosis bacteria were actually becoming resistant to the drug. So the trial didn't just show a short-term win. It uncovered a major long-term problem that needed a whole new solution.
And these same rigorous methods were then used to tackle big public health questions. Austin Bradford Hill, along with Richard Dahl, used these huge statistical studies to figure out why lung cancer rates were skyrocketing. And their landmark study of 40,000 doctors came back with this absolutely stunning finding. Heavy smokers were 25 times more likely to die from lung cancer. It was the irrefutable proof that finally linked smoking directly to the disease.
Okay, so after this whole journey through medical history, what have we really learned about the power and the pitfalls of using data to find the truth? Well, there are a few core principles that just keep popping up. We learned that just because two things happen together doesn't mean one causes the other. Cholera wasn't caused by sea air, it was caused by the polluted water. We learned to hunt for those hidden confounding factors, like the age of the patients in the bloodletting study. And we saw how randomization is the absolute best tool we have to get an unbiased answer, as long as your study is big enough that the results aren't just a fluke. And this brings us right back to today. The work of pioneers like Lind, Snow, and Hill built the entire foundation of modern medicine. Their struggle to replace dogma with data is the reason we can trust our treatments to be safe and effective. And it all leaves us with one final, pretty fascinating question. What accepted medical truth of right now is just waiting for the right data and the right study to be completely overturned?